Hello, my name is Sheila Apple. I have done my course project on heart disease. Heart disease is the leading cause of death in both women and men in the United States. What I hope to provide in this presentation is a clarification on what heart disease is, what the common causes are, what the effects of heart disease are on the human body, forms of heart disease, and the cause and treatment of these forms. Heart disease is a broad term used to cover many different conditions that affect the heart. Some of these conditions can start as early as childhood and worsen throughout adulthood. Some of the common causes are smoking, high blood pressure, diabetes, and inflammation of blood vessels. Some of the effects of heart disease occur to the heart, the arteries, and other parts of the body dependent on the disease. Coronary artery disease is the most common form of heart disease in the United States, but people can also suffer from arrhythmias, heart failure, and heart attacks. There are several different forms of heart disease. Four of the most common are heart attack, coronary artery disease, heart failure, and arrhythmias. They all have different symptoms, and sometimes the symptoms vary from male to female or person to person. It's important to recognize these symptoms because it could help determine if a disease is part of your lifestyle, and the changes can be made to help improve that. One of the main forms of heart disease is coronary heart disease. This happens when plaque builds up on the coronary arteries, causing symptoms to present. If it's severe enough, it could lead to arrhythmias, heart failure, or heart attack. Some symptoms include angina and pain in the neck, jaw, throat, upper abdomen, or back. Coronary artery disease can be changed and treated with different forms of treatment. Medications, exercise, and dietary approaches are a few of the examples. Another form of heart disease is a heart attack. Heart attacks are a medical emergency. If you do have symptoms, you should call 911. A heart attack occurs when a section of the heart is damaged because of obstructed blood flow. Heart attacks can present different between males and females. Some of the common symptoms include chest pain and discomfort, heartburn, nausea and vomiting, upper back and neck pain. Sometimes shoulder pain is also part of the symptoms. Extreme fatigue and shortness of breath are also symptoms. A heart attack can be treated in different ways depending on the severity. Sometimes the treatment just includes lifestyle changes to prevent another heart attack. Medications are used, surgeries to clear the obstruction, and sometimes medical devices are used to be implanted, such as pacemakers and internal defibrillators. Arrhythmias are another form of heart disease. They're usually not life-threatening. If the heart is unable to pump enough blood, it can become a life-threatening situation. It could lead to heart failure or heart attack. The symptoms include fluttering heart and pounding heart, chest pain or fainting. Sometimes dizziness is associated. It can be treated most often with medications, but sometimes medical procedures are needed. Pacemakers may be inserted to keep the heart pumping regularly. Heart failure is the last form that I have documented for this presentation. Heart failure is not the failing of the heart. It just means that the heart does not have enough power to pump enough blood throughout the body. giving the body enough nutrients to support itself. When this happens, it also deprives the body of oxygen. Some of the symptoms are shortness of breath, fatigue, and swelling in the feet and ankles, legs, and abdomen. Heart failure can have other effects on the body instead of just the heart. It can affect other parts, other organs, if lack of oxygen or blood is supplied to them. The treatment of heart failure depends on the stage and the type. The main goal is to treat the underlying causes and maintain a quality of life that is acceptable. Dietary changes, medications, and surgeries can all help with heart failure in maintaining the quality of life. The heart is the epicenter of the body. If there is an issue with the heart, it will, in time, cause issues throughout the entire body, affecting systems and organs. This is especially true when oxygen and nutrients are unable to cycle correctly throughout the body. Over time, this can lead to damage to other organs in the body. Heart failure is a serious condition and needs medical treatment when necessary. This concludes my presentation.